Thank you, everyone, for taking time to join us this evening for our session. Before we dive in, there's a lot of new emerging technology to make practice medicine a little bit better. I'm just going to talk about two such technology that are emerging before we dive into the demo that Kat will be leading. Can I have next slide, please? Oh, I forgot. So before I dive into my topic, I want to acknowledge two persons that are joining us tonight, Dr. Herbert Chang and Dr. John Yap. Both are longtime PSP champion and physician peer mentors. So they have supported our program for a long time and are super users. So feel free to jump into the chat if you have anything to share. Thank you very much. And at the end, if time permits, we would love to hear some of your thoughts as well. So with that, I would like to talk about AI scribes. Before I dive into that, can I just get a show of physical hand or virtual hands? How many of you guys have heard of AI scribe or maybe even using AI scribe? Okay, there's some. Yay. That's great. So there's a few hands going up. So that means I'm not breaching a brand new topic to everyone. So that's great. So I will go a little bit. Right now, this is just a high-level introduction. We're not diving deep into AI Scribe, but for those that already are using it, you already know what it is. It's basically a large language model AI that will actually listen to the conversation, transcribe it, and then summarize it. Now, the summarize note can be in a SOAP format, it could be in a paragraph format, it could be in point form. There's a whole bunch of templates now that are being created with the AI Scribe when you subscribe to the AI Scribe vendors. So the other nice thing about this is from the transcript, they can also generate a patient handout for the patient. So it's actually take out the medical terms potentially and give a layman's explanation of what happened or what transpired in the encounter. So that's another neat feature of AI Scribe. The other thing it can also do is actually from the transcription, if you need to refer the patient to another provider, it also has templates there within that to do that as well. So AI Scribe can potentially be a huge time saver. There's been early studies show some benefit of AI Scribe is reduce cognitive load, being more present in the encounter with the patient because now you don't need to worry about taking notes or have your charts open and making little points. So for when you go back to the end of the day, so you can type your notes. Now all that is there, being captured by the AI scribe. So, but the other thing about AI scribe though is that um, it's highly customable. And you don't need to be a programmer, don't need to be a techie. Some of the AI scribe, you just merely go into the template and say, I would like the lot number and the batch and the serial number for the immunization. Please record that in the encounter notes. And it will do something like that. Or you can just say, please keep my note short and brief in point form. And so that's all you need to do. And that's how you can customize your note easily for AI scribe. So that is AI scribe at a very high level. I also want to sort of talk about the CHI, Canada Health InfoWave AI Scribe program. So that was launched on June 10th. CHI basically is paying AI Scribe license about 10,000 across the country for 1 year. So for providers to experience AI Scribe. Now, BC has already maxed out their allotment of licenses, but other part of the country might not have, and so there might be reallocation of licenses. So if you're interested, please check out the CHI AI Scribe program. Now, the other thing I want to talk about is if you're doing AI Scribe in terms of hardware. So it's a beautiful software, but like dictation software, it's only as good as the hardware that goes with it. And one of the things that you probably will need is a microphone. So because I know some of the doctors that I've supported have worked around because sometimes the AI Scribe also have a mobile version. So what they do is they actually run the AI Scribe software on their phone, and the phone becomes their microphone, and they put their phone out there to record the conversation. And then that transcripts is uploaded to their account, and then they open their computer version, desktop version of the AI Scribe, and then they work from there to copy and paste into their EMR. So one of the consideration might be a little bit of hardware depending on your clinic setup. So I just wanted to sort of bring that point, mention that point as well. All righty. Nicholas, can I get the next slide, please? Thank you. The next technology I wanted to mention, because along with today's topic, is dot phrases or text expanders. Some of these software are free, some of them cost money. But what they are is software that allow you to put in a code and a trigger, usually the backslash key. And what we'll do is it will replace that code word with your body of text. The text body of text can be one sentence, could be a paragraph, can be an essay. So just having those code words can save you a lot of typing. So that is a very useful feature. Now, text expander and dot phrases are third-party software. One of the advantages of that, if you are, for example, a locum that practices at multiple clinics, you don't need to memorize new codes every time you walk in a clinic. You could just take your software with you have your already predefined codes with predefined text, and you can use that uh, at all the location you go to. So that's the definite plus. If you're a doctor that only really practice one location with one EMR, most of the EMR have a similar function built in as well. So it's already built in, but you do need to learn the codes and you do need to learn what that code represent in terms of the text. But once you learn that, if you're only practicing one clinic, you don't need a third-party software to do that. And so you can actually just use what's built right into the EMR right off the bat. Okay. So that's another time saver for those people that are poor typists like me. I'm a slow typist. Um, you know, these technology can save a little bit of keystroke or finger aches. So, and then with that, that's sort of the two technology I want to sort of mention. If there's any questions, feel free to put them in the Q&A, or if anyone has a really pressing question, they can unmute and ask. Otherwise, I will give it a minute, and then I will pass the floor over to my colleague, Kat.
So I'm not seeing anything in the Q&A box just yet, but we do have, time for one or maybe two questions. But as Henry said, if we don't have any here, that's totally okay. We can move on to the next section. So what we're going to try to do is after every sort of topic piece, we'll have a little bit of time for one or two questions. If we have a plethora of questions, we'll probably hold extra questions to the end of the session. Oh, so Kat looks like copied one from the chat. So where can we get AI Scribe for training? I wonder if that's related to where can you get like an AI Scribe? So I think Henry, you kind of mentioned that through Canada Health Infoway, there is a program. Obviously, that program right now is full, but it sounds like there might be some possibility of some additional licenses coming from other provinces and getting reallocated. So it's a good idea to sign up for the program. And I see that Dr. Chang put in a link to that program for anybody that's interested in there to get a little more information.
Yes, thank you. So if you're interested to dip your toe in the water for AI Scribe, CHI has vetted 9 AI Scribe for Canada. So you're welcome to definitely go visit the page that Herb has posted the link, and you can take a look at those AI Scribe. If you don't get into the program, you can sign up for a trial license, and that will give you about 30 plus days to try out the AI Scribe. And even during the trial period, if you want support from the vendors, they're more than happy to connect with you and show you their program. So if you're definitely interested, definitely reach out to the vendor. Definitely sign up for the trial licenses and try them out.
I think Dr. Chang has a little bit extra to, so feel free to come off if you want to.
Absolutely. What you said is totally accurate about Canada Infoway and what they trial. Now, there is one additional way you can sign up for a Scribe, and I'm not, selling it or anything like that. But for people who can't get into Canada Infoway and would like to try a Scribe Heidi, which was not on the Canada Infoway group, mainly because they were non-Canadian, although they do have Canadian support and their servers are in Canada. And I'm not getting paid by Heidi or by any way. But Heidi is offering a 1 year a family physician account for use of Heidi right now because they weren't a part of Canada Infoway, but you can go to Heidi and try that if you can't get in on Canada Infoway.
Awesome. Thanks so much for that additional context. So there is one quick question in here, which I think, Kat, you might be able to just quickly, um, and you might touch upon it. So the question is, are templates the closest thing to dot phrases in Oscar? Is that a very similar thing?
Yeah, happy to address this question in our demo, but yeah, depending on the version of Oscar, that is correct. Templates would be the dot phrase equivalent. And like Henry said, dot phrase and text expanders are basically you're creating your own templates in your own repository that you can, it goes with you. So it'll travel with you if you're at multiple different clinics. But if you're at one clinic using the same EMR, we would probably advise against a dot expander because it would almost be like duplication of work because you could set up your templates in Oscar instead. But if you are going to multiple Oscars or Oscar and MedAccess or Oscar and Akuro, and you just want to have consistency in template creation, dot expander might be a good option for you.
Perfect. Thanks so much.
All right, I think I'll pass that over to Kat since we're already diving into the topic already. So.
Awesome. Thank you.